My name is Erika, and this is a presentation about chikungunya virus and its vaccine, Ixchiq. Chikungunya is a mosquito borne viral disease transmitted by Aedes mosquitoes, predominantly the Aedes aegypti and the Aedes albopictus, which are typically daytime biters, although transmission can occur all throughout the day. Typical symptoms can include fever, joint pain, fatigue, and rash. It is important to note that the joint pain from the chikungunya infection can be quite severe and debilitating, often affecting activities of daily living. The chikungunya infection is rarely fatal, and the fatalities has almost always been related to other existing health problems or age. Atypical presentations can also occur, and this can affect other organs such as the neurological system, GI, cardiovascular, and other systems. Most people make a full recovery, but pain in the joints can last for months or even years. At this time, there is no treatment for chikungunya and there is only symptom relief. The word chikungunya, which means that which bends up, in the Makonde language of Tanzania, describes the severe arthralgia characteristic of the infection. As you can imagine, this can affect a person's mobility, their ability to take care of themselves, and perform their day to day activities. The typical joints affected involves the hands, knees, wrists, ankles, and shoulders. The chikungunya virus has a significant global presence, with outbreaks reported across Africa, Asia, Europe, and the Americas over the past 5 years. Notable cases include ongoing outbreaks in Asia, significant incidents in Africa, traveler linked instances in Europe, and rising localized outbreaks in the Americas. As you can see, chikungunya is quite widespread and has been identified in over 110 countries all over the world. Even in Canada, there have been cases of chikungunya in travelers, disproportionately affecting women. Now we'll move on to the chikungunya vaccine Ixchiq. The Ixchiq vaccine is a novel, live attenuated vaccine set to be available in Canada this November. It is given as a zero point 0.5 ml IM injection as a single dose in individuals 18 years of age and up. It is important to note that this is the only live vaccine that is given intramuscularly. The immunity following an Ixchiq vaccination lasts for at least 2 years, although longer follow up studies with vaccinated individuals are underway. But at this point, there is no booster needed. The Ixchiq vaccine is recommended for people aged 18 years and up traveling to a country or territory where a chikungunya outbreak exists. The vaccine may also be considered for people who are traveling to areas without an outbreak but with evidence of chikungunya transmission among humans. This is especially important for people aged 65 and up, particularly those with underlying medical conditions who are likely to have at least moderate exposure to mosquitoes. So, this can include activities such as camping, hiking, trekking, biking. Those would make them more at risk for exposure to the virus. The vaccine should also be considered for people staying for prolonged periods, so 6 months and up, in areas with evidence of chikungunya transmission. As mentioned earlier, the Ixchiq vaccine is a live vaccine administered intramuscularly as a single dose. So all of the contraindications for other live vaccines will also apply. Contraindications include for pregnant or immunocompromised people. It is also advised that women of childbearing age to avoid pregnancy 1 month following vaccination. There is also caution advised for individuals with immune mediated arthritis, as we have limited data available, as these people were part of the exclusion criteria during clinical trials. The exact duration of immunity is unknown at this point, although antibody levels have remained well above the zero response threshold of above 97% zero response rate 24 months after a single vaccination. The immunity following vaccination is quite possibly longer than 24 months or 2 years, as there is immunity following chikungunya virus infection, and it's thought to convey lifelong immunity. Further data regarding the immunity duration will be published at a later time. Adverse reactions to the vaccine. Common adverse reactions include over 10% of vaccinated individuals during clinical trials, so that can include injection site tenderness, headache, fatigue, myalgia, arthralgia, fever, and nausea. There are severe chikungunya like adverse reactions, and we've seen them in about 1.6% of the vaccine recipients, and these reactions have lasted longer than 1 month. Just like other live vaccines, this vaccine can be administered either on the same day as or at least 4 weeks apart from other live vaccines, such as yellow fever, measles, mumps, rubella, or chickenpox. Just like other vaccines, for storage, the vaccine should be kept between 2 degrees and 8 degrees Celsius, and the vaccine should be administered within 30 minutes after reconstitution. And this concludes the presentation for Ixchiq and the chikungunya virus.